If you are over 60 and you're taking vitamin B12 every single day because you were told it boosts energy, protects your brain, and prevents nerve damage, what if I told you that you might be taking it the wrong way, absorbing almost none of it, and in some cases even masking a much bigger problem? And what if the very form, timing, or method you're using is the reason you still feel tired, foggy, or unsteady on your feet? Today we're going to unpack a topic that has confused millions of seniors, and we'll also touch on insights often discussed by natural health educator Barbara O'Neill about proper nutrient absorption and why method matters just as much as the nutrient itself. By the end of this video, you'll understand not just whether you need B12, but exactly how to take it the right way for your age and your body. Let's begin with something most people don't realize. Vitamin B12 deficiency is incredibly common after the age of 60, but not because seniors don't consume enough B12. In many cases, they're eating it. They're even supplementing it. The real issue is absorption. As we age, our stomach produces less hydrochloric acid. This acid is essential for separating B12 from the protein in food. Without enough stomach acid, B12 passes through the digestive system unused. On top of that, the body needs something called intrinsic factor, a protein made in the stomach, to properly absorb B12 in the small intestine. Reduced intrinsic factor production is extremely common in older adults, especially those with chronic gastritis or autoimmune conditions. Now here's where many seniors go wrong. They buy a standard low-dose B12 tablet, swallow it like any other vitamin, and assume it's being absorbed. But if intrinsic factor levels are low, that pill may be doing very little. This is why some doctors see patients whose blood levels look borderline normal, yet they still show symptoms of deficiency, and this is also why simply taking more isn't always the answer. The form and delivery method matter tremendously. Let's talk about symptoms for a moment, because they are often subtle and mistaken for aging. Fatigue that doesn't improve with rest, tingling or numbness in the hands and feet, memory lapses, difficulty concentrating, mood changes, unsteady walking. Some people even experience shortness of breath or heart palpitations. These are not just normal signs of getting older, they can be red flags that your nervous system is not getting what it needs. Now here's something important. Vitamin B12 plays a critical role in nerve insulation, red blood cell formation, and DNA synthesis. When levels drop too low for too long, nerve damage can become permanent. That's why timing matters. Waiting until symptoms become severe is not wise. Another common mistake seniors make is assuming that all forms of B12 are the same. You'll often see cyanocobalamin on supplement labels. It's inexpensive and stable, which is why manufacturers use it. But cyanocobalamin must be converted by the liver into active forms before the body can use it. For many older adults, especially those with reduced liver efficiency or chronic illness, that conversion may not be optimal. Methylcobalamin, on the other hand, is an active form that the body can use more directly. Adenylcobalamin is another active form involved in mitochondrial energy production. Choosing the right form can make a noticeable difference. And then we have the method of delivery. If you have reduced intrinsic factor, swallowing a standard tablet may not be enough. Sublingual B12, which dissolves under the tongue, allows some absorption directly into the bloodstream through tissues in the mouth. This bypasses part of the digestive process. For individuals with significant absorption problems, B12 injections prescribed by a physician may be necessary. These completely bypass the digestive system and deliver B12 directly into circulation. Another issue is dosage. Many seniors take very small doses like 100 micrograms, believing that more would be excessive. But when absorption is impaired, higher doses are often needed to compensate for the reduced efficiency. It's not uncommon for doctors to recommend 500 to 1,000 micrograms daily in supplement form for older adults, especially if blood levels are low. Of course, this should always be discussed with a healthcare provider, especially if there are other medical conditions involved. Let's also address medications. Certain common prescriptions dramatically reduce B12 absorption. Proton pump inhibitors, often used for acid reflux, decrease stomach acid production. Metformin, widely prescribed for type 2 diabetes, interferes with B12 absorption in the small intestine. If you are on these medications, your risk of deficiency increases significantly, yet many people are never told to monitor their B12 levels regularly. There's also confusion around testing. Standard serum B12 blood tests don't always tell the full story. Some people show normal levels, but still have functional deficiency at the cellular level. In more complex cases, doctors may test methylmalonic acid or homocysteine levels, which can reveal whether B12 is truly active inside the body. If you're experiencing symptoms but your basic test says you're fine, it may be worth having a deeper conversation with your provider. Diet is another piece of the puzzle. B12 is found primarily in animal products like meat, fish, eggs and dairy. Seniors who eat very little protein or who follow strict vegetarian or vegan diets are at higher risk unless they supplement correctly. Even with adequate intake, however, absorption remains the key issue in older adults. Now let's talk about a mistake that's less discussed. Some people take high doses of folic acid without ensuring adequate B12 levels. Folic acid can correct certain types of anemia caused by B12 deficiency, masking the blood abnormality while nerve damage continues silently. This is why balance matters. You don't want to fix one lab value while another problem worsens underneath. There's also the question of timing. Taking B12 earlier in the day is often recommended because it supports energy metabolism. Some people report sleep disturbances if they take high doses at night. While not universal, it's something to consider. Hydration and gut health also influence nutrient absorption. Chronic constipation, intestinal inflammation, or imbalanced gut bacteria can reduce nutrient efficiency. Supporting digestive health through adequate fiber, hydration, and possibly probiotics may indirectly support better B12 utilization. Another important distinction is between short-term supplementation and long-term strategy. If a blood test confirms severe deficiency, aggressive correction may be needed initially. But once levels stabilize, maintenance dosing becomes the goal. Oversupplementation without monitoring isn't wise either, even though B12 is water-soluble and generally considered safe. Let me address a common myth. Some people believe that if they feel tired, they should automatically take B12 shots for an energy boost. While B12 can improve energy in deficient individuals, it does not act like caffeine. If your levels are already adequate, more B12 will not magically create extra energy. The key is correcting deficiency, not chasing stimulation. We also need to consider neurological health. B12 deficiency has been associated with cognitive decline and memory issues. While it is not a cure for dementia, correcting deficiency can improve cognitive symptoms in some individuals. This is why early identification is so important. Now, how do you know what to do from here? First, if you're over 60, ask your healthcare provider to check your B12 levels at least annually, especially if you're on acid-reducing medications or metformin. Second, if levels are borderline and you have symptoms, discuss the possibility of higher dose oral methylcobalamin or sublingual forms. Third, evaluate your diet. Ensure you're consuming adequate high-quality protein unless medically restricted. Fourth, do not rely solely on multivitamins, which often contain very small amounts of B12 that may not be sufficient for older adults. If you've already been diagnosed with deficiency, follow-up testing is crucial. Don't just supplement blindly and assume it's fixed. Monitor your levels and your symptoms. Let's bring this together. The wrong way to take vitamin B12 is assuming that swallowing a small generic tablet automatically solves the problem. The wrong way is ignoring symptoms because you think they're just aging. The wrong way is failing to consider absorption issues, medications, or the form of B12 you're using. The right way is personalized, monitored, and absorption-focused. Vitamin B12 is not just another supplement on the shelf. For seniors, it can be the difference between steady balance and falls, sharp thinking and brain fog, vibrant energy and chronic fatigue, but only if it's taken correctly. So here's the bottom line. As we age, absorption changes. The form, dose, and delivery method of vitamin B12 matter more than most people realize. Don't guess, don't assume, test, evaluate, and choose the form that fits your body's needs. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what topic you want to see next. Your health is too important to leave to chance, and small adjustments today can protect your independence for years to come. Here's what most seniors are never told about vitamin B12. You can be eating well, taking supplements faithfully, and still slowly developing a deficiency that affects your nerves, your balance, your memory, and even your mood. And the most dangerous part is that the symptoms often look exactly like normal aging: slower thinking, tingling in the feet, fatigue that doesn't go away, slight instability when walking. Many people dismiss these signs for years, but in reality, vitamin B12 deficiency can quietly damage the nervous system long before a routine blood test clearly flags a problem. Natural health educator Barbara O'Neill has frequently emphasized that it's not just what you take that matters, but whether your body can actually absorb and utilize it, and that is where most seniors go wrong. Let's go deeper into why this happens. After the age of 60, your digestive system simply does not function the same way it did at 30 or 40. Stomach acid production naturally declines. This matters because B12 in food is tightly bound to protein. It requires adequate stomach acid to break it free. Without sufficient acid, that B12 remains attached and passes through your system unused. Even worse, many seniors take acid-reducing medications for reflux or heartburn. Proton pump inhibitors and H2 blockers further suppress acid production, dramatically lowering B12 absorption over time. Then there's intrinsic factor, a specialized protein produced in the stomach that binds to B12 and allows it to be absorbed in the small intestine. Some older adults produce less intrinsic factor. Others develop autoimmune conditions like pernicious anemia, where the body attacks intrinsic factor itself. In these cases, swallowing a standard tablet becomes almost ineffective because the transport system is compromised. Now let's talk about the form of B12. Many over-the-counter supplements contain cyanocobalamin. It's stable and inexpensive, but it is not the active form your body uses. It must first be converted in the liver into methylcobalamin or adenosylcobalamin. In younger, healthy individuals, this conversion is usually efficient. But in seniors with liver stress, chronic illness, or metabolic issues, conversion can be less reliable. That's why many practitioners recommend methylcobalamin for older adults. It's already in an active form and doesn't require as much metabolic processing. Another major mistake is dosage misunderstanding. Some seniors are afraid of taking too much B12. They see numbers like 1,000 micrograms and think it's excessive. But here's the reality. B12 is water-soluble. Your body absorbs what it can and excretes the rest. When absorption efficiency is low, higher doses are often necessary to ensure that enough actually enters the bloodstream. A small 50 or 100 microgram tablet may not compensate for impaired absorption. That's why many physicians recommend 500 to 1,000 micrograms daily for older adults at risk, sometimes even more in deficiency states. But dosage alone isn't enough. Delivery method matters just as much. Sublingual tablets that dissolve under the tongue allow some B12 to enter directly into the bloodstream through oral tissues. This partially bypasses the need for intrinsic factor. For individuals with significant absorption issues, B12 injections may be the most effective route because they completely bypass the digestive tract. Many seniors report dramatic improvements in energy and mental clarity after medically supervised injections when oral supplements fail to help. Let's also address testing, because this is another area of confusion. A standard serum B12 test measures total circulating B12, but it doesn't always show how much is active at the cellular level. Some individuals have normal blood levels but still experience deficiency symptoms. In these cases, doctors may check methylmalonic acid or homocysteine levels, which can reveal functional deficiency. Elevated levels of these markers suggest that B12 is not being properly utilized inside cells. Now consider medications beyond acid reducers. Metformin, commonly prescribed for type 2 diabetes, is strongly associated with reduced B12 absorption. Long-term use significantly increases deficiency risk. Yet many patients taking metformin are never advised to monitor their B12 annually. Over time, neuropathy caused by B12 deficiency may even be misattributed to diabetic nerve damage. Symptoms deserve special attention. Early signs may include subtle fatigue, slight mood changes, mild forgetfulness, or occasional numbness in fingers or toes. As deficiency progresses, balance can worsen, reflexes can diminish, and memory can decline further. Severe, prolonged deficiency can lead to irreversible nerve damage. This is why early correction is critical. Another overlooked issue is the interaction between folate and B12. High folic acid intake can correct anemia caused by B12 deficiency, making blood tests appear normal while neurological damage continues silently. This masking effect can delay diagnosis. Seniors taking high-dose folic acid supplements without checking B12 levels may unknowingly increase their risk. Dietary intake is also important. Vitamin B12 is found almost exclusively in animal products such as beef, poultry, fish, eggs, and dairy. Seniors who eat very little protein, have poor appetite, or follow vegetarian or vegan diets are at increased risk. Even with adequate intake, though, absorption remains the primary challenge in older adults. Timing can influence how you feel as well. Because B12 supports energy metabolism and red blood cell production, many people find it best taken in the morning. Taking it late at night may interfere with sleep in sensitive individuals. While not universal, it's worth experimenting under guidance. Gut health plays a role too. Chronic inflammation, intestinal disorders, bacterial overgrowth, or long-standing digestive problems can impair nutrient absorption. Supporting gut integrity through balanced nutrition, adequate fiber, hydration, and professional guidance may indirectly improve B12 status. Let's correct another misconception. Some people treat B12 as an energy stimulant. They request injections purely for a boost. But if your levels are already sufficient, extra B12 won't act like caffeine. It corrects deficiency. It doesn't artificially stimulate energy. The goal is balance, not excess. There's also growing interest in the connection between B12 and cognitive health. While B12 is not a cure for dementia, deficiency can mimic cognitive decline. In some cases, correcting low B12 levels improves memory and concentration. This is why unexplained cognitive symptoms in seniors should always prompt evaluation of B12 status. So what should you actually do? First, if you are over 60, ask for annual B12 testing, especially if you take acid reducers or metformin. Second, if levels are borderline and you have symptoms, discuss higher dose methylcobalamin or sublingual forms. Third, evaluate your protein intake and overall nutrition. Fourth, don't assume a multivitamin is enough. Most contain minimal B12 amounts that may not meet older adults' needs. Most importantly, don't ignore symptoms. Persistent fatigue, tingling, numbness, balance issues, or memory changes deserve investigation. Early correction can prevent long-term complications. The wrong way to take vitamin B12 is blindly swallowing a low-dose tablet without understanding absorption. The right way is individualized, monitored, and focused on ensuring that the vitamin actually reaches your cells. When taken properly, B12 can support nerve integrity, red blood cell production, cognitive clarity, and overall vitality in your later years. If this helped clarify things for you, make sure to subscribe to the channel, like this video, and tell me in the comments what health topic you'd like covered next. Your independence and well-being depend on informed decisions, and small changes today can make a powerful difference tomorrow.